One of the potentially promising approaches is called TIL therapy. TIL stands for tumor infiltrating lymphocytes. The philosophy behind the TIL system is to isolate the lymphocytes from a lesion, assuming that only the lymphocytes that stick to the cancer are those that are capable of responding against that cancer. And then those lymphocytes can be enriched, in the laboratory under clean room conditions. And then you can use a much higher number of tumor infiltrating lymphocytes in order to treat the patient. That treatment can sometimes be helpful, not always. Unfortunately, it is extremely expensive. It takes a very professional center to establish such a treatment, and frequently it is not good enough to control the disease. As I indicated earlier, TIL therapy can be effective. Rarely cures, but can be effective. So in certain cases, it may be indicated, but I prefer to exploit the use of more conventional immunotherapeutic agents, like combination of checkpoint inhibitors, and then use a very long list of off-label medications that have known anti-cancer activity before I go to recommend TIL therapy, which is extremely expensive, time-consuming, and not always effective. Furthermore, I personally believe that if patient is at a stage of minimal disease, the better therapy would be to use allogeneic, in other words, lymphocytes derived from a donor, from a family member, because foreign lymphocytes, so-called allogeneic lymphocytes, can kill cancer much more effective than patients' own lymphocytes. Patients' own lymphocytes are, in principle, tolerant to the tumor. And this is why patients develop the tumor to start with. Because once upon a time, every cancer patient had a single cancer cell. If his own immune system could fight effectively against the cancer, then the patient would not have cancer to start with. Whereas allogeneic lymphocytes can eliminate cancer because it is foreign, and the immune system is very well equipped to reject anything that is foreign. There's one additional fact regarding the TIL. In order to start the TIL, tissue must be obtained, and lymphocytes that are present in that tissue must be expanded, enriched. So if the patient does not have any lesion that can be taken out in order to isolate the tumor-infiltrating lymphocytes, then TIL cannot be accomplished. Also, sometimes it is difficult technically to enrich the lymphocytes, to get sufficient number of cells to make it possible to treat the patient with TIL. So in addition to the cost and other technical aspects, in some situations, TIL cannot be accomplished.